Hello and welcome everyone. Today we are learning about folic acid. Folic acid, which is also called vitamin B9. It is a water soluble vitamin used to manage and treat megaloblastic anemia. Folate is a generic term that typically refers to a group of water soluble compounds that play an essential role in DNA biosynthesis. Folic acid is a synthetic form of folate. Folate converts to tetrahydrofolic acid. This compound undergoes several transfer or methylation reactions that are important for synthesizing nitrogenous bases in DNA and RNA. They are necessary for maturation of RBCs. Folic acid is stored in liver and kidney. Folic acid deficiency. It manifests as a macrocytic megaloblastic anemia, usually from chronic alcoholism, malabsorption, hemolytic anemia, or increased requirement during pregnancy. One of the most important indications for folate use is considering the development of CNS in fetus during pregnancy. Women planning on getting pregnant should take folic acid supplements to reduce the risk of neural tube defects such as spina bifida in developing fetus. If the pregnant mother were to take 4 mg of folic acid daily, it could take 20 weeks for her body to reach optimal folate levels to reduce the risk of neural tube defect. Because of this, supplementation should be initiated 5 to 6 months before conception. The recommended daily requirement of folic acid for an adult is 400 microgram. For pregnant women, it is 600 microgram. For lactating women, it is 500 microgram per day. Folic acid may be given orally, intravenously, or subcutaneously for macrocytic anemia. Oral recommendations are 1 mg to 5 mg once daily. It is also the same dose for folic acid deficiency in the patients with hemodialysis. Patients treated with methotrexate should be prescribed folic acid supplements to reduce adverse events associated with therapy. Deficient folate level has been detected in up to 60% of patients on anti-epileptic drugs such as gabapentin, phenytoin, carbamazepine, valproate, and primidone. Food sources for folic acid. Sources are mainly green leafy vegetables such as spinach, broccoli, lettuce. Others are legume, meats, eggs, and milk. Asparagus contains 130 microgram of folate per 100 gram. Egg has a 22 microgram of folate per 1 egg. Green leafy vegetables such as spinach, kale, broccoli, and lettuce has a 60 microgram of folate per 1 cup. Beet contain 110 microgram of folate per 100 gram. Citrus fruits such as oranges, grapefruit, lemon, and lime contain 50 microgram of folate per 1 fruit. Papaya contain 50 microgram per 1 cup. Banana contain 25 microgram per 1 banana. Milk has a 15 microgram of folate per 200 ml of milk. Beef liver contain 200 microgram of folate per 100 gram. Serum folic acid level. The reference range for serum folic acid level is more than or equal to 4 microgram per liter. Serum level below 4 microgram per liter suggests folate deficiency. The sample required is a serum sample either in the plain tube, clot activated tube, or gel separator tube. Here are some methods commonly used in clinical practice to detect folic acid level. First is liquid chromatography tandem mass spectrometry LC-MS. It is highly sensitive method that allows for quantification of folate in clinical samples. Second is high performance liquid chromatography. HPLC coupled with the various detectors such as mass spectrometry can be used to assess folate levels. It offers good sensitivity and specificity. And third is most commonly used method in clinical laboratories is automated competitive protein binding assays CPBs. It utilizes folic acid binding protein for analyte capture. Serum folate is a relatively non-specific test. Low serum folate levels may be seen in absence of deficiency and normal level may be seen in patients with macrocytic anemia, dementia, neuropsychiatric disorders, and pregnancy disorders. Serum folate measurement is preferred over RBC folate measurement due to considerable analytic variability of assays. In folate deficiency, homocysteine levels are elevated but methylmalonic acids are normal. Evaluation of macrocytic anemia commonly require measurement of serum concentration of both vitamin B12 and folate. Ideally, they should be measured simultaneously. This is in short about folic acid, and these are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.